और समीक्षाओं में आपका योगदान रहा है। आपने एक पुस्तक और 2 अध्यायों का लेखन किया है। आपको वर्ल्ड फेडरेशन ऑफ बायोलॉजिकल साइकियाट्री से यंग इन्वेस्टिगेटर अवार्ड प्राप्त हुआ है। आपका शोध उपचार प्रतिरोधी स्किज़ोफ्रेनिया, मनोविज्ञान और न्यूरोसाइंस के क्षेत्रों में सेतु का काम करता है। श्रीमती इंदिरा दास studied medicine at the prestigious Kolkata Medical College and specialized to be a gynecologist at the Calcutta National Medical College and Research, PGI MER Chandigarh. She is a practicing specialist and long-term entrepreneur and of course a renowned gynecologist. She hails from a family where music and literature have been a way of life. She is proficient with the pen since childhood. Her literary activities were widely published as she grew up, fluent both in English and Bengali. Her poetry, essays, and columns penned by her have all received great acclaim. श्रीमती नीना कनोजिया हिंदी की एक प्रतिष्ठित लेखिका और कवयित्री हैं। आपकी कविताएं और कहानियां साहित्यिक पत्र पत्रिकाओं में प्रकाशित होती रही हैं। आपने कुछ महत्वपूर्ण कृतियों का लेखन किया है और साहित्य के क्षेत्र में अपना विशिष्ट स्थान बनाया है। And moderating this session is Professor Sudha Seshayan. She is the former Vice Chancellor of the Tamil Nadu Dr. MGR Medical University at Chennai. I request you to join us on the dais, please. She is a physician, teacher, and administrator, and has been so for the past 30 years. She has 30 titles to her credit in literature, spirituality, history, biography, and social values, and is a regular columnist in popular Tamil magazines. She has edited a textbook of anatomy in 3 volumes and has compiled the translated version of the Britannica Concise Encyclopedia in Tamil. She is the recipient of the T.S. Balakrishna Sastrigal Award, Sarvodaya Jagannath Award, amongst others. I hand the mic over to Professor Seshayan to moderate the session, please.
Namaskar. Thank you very much. Without much ado, I would get into the session. Words that mend. Will literature be part of therapy? There are several questions which are raised on this statement. Can words become some kind of treatment? Will words be able to heal? Will words be able to repair and mend? Time immemorial, we have heard books being read to people, read to children, read to people who are a little imbalanced, read to people who are in some kind of a worry and anxiety. And all through these books, elements of literature have been able to heal, guide, and show a kind of a positive future. If this traditional image will have to be followed and remembered, there are further questions to the same proposition. Will every book be a healer? And will every individual benefit from the same book? Would the same piece of literature help a child of 5 years of age and a woman of 45 plus as well? On the other side, there are also questions as to what kind of books would be healers. Would works of literature from the past can heal better, or would modern literary contribution heal better? Would an individual adapt to something which is called fiction, or better to a non-fiction? Friends, there are several questions abounding with regard to this statement that literature is therapy. I'm also bound to remind all of you that there is a science called bibliotherapy. Bibliotherapy, though is a science, composes elements of arts. Bibliotherapy is a term that came into the English language dictionary sometime in the 1910s. However, the history of bibliotherapy is not that very short. We hear that the library of King Ramses of Egypt had a statement written on its wall, and the translation of the statement would mean, "This is a place that heals the soul." Galen, one of those scientists of repute whom the medical world regards with utmost sincerity even to this day, had a huge collection of manuscripts and books which he put to use for the sake of healing people who came to him with several kinds of ailments. And in our own tradition, in the Indian system of tradition, we find several times stories were told, Puranas were recapped at every occasion, either be a marriage, a personal ceremony in a house, or a kind of a massive gathering where the entire community conglomerated. So with that kind of information at the back, let me now request the esteemed panelists here to offer their opinions and views on this very important area called literature being therapy. And I'm extremely happy that I have a galaxy of medical professionals, not only from the field of allopathy, but also from Ayurveda. So we have a complete cross-section of experts and a cross-section of information that would flow in. Bibliotherapy, the very term will indicate it is something to do with a drug. Therapy is usually related to some kind of treatment, not necessarily a drug that is bottled or capsuled, but then some kind of a healing mechanism. And here we have a clinical pharmacologist, Madam Archana, and I would request Madam Archana to give her opinion as to what kind of a therapy would the books or would representations of literature do. Madam, please.
Thank you, ma'am, for such a beautiful introduction to the topic, so that all of us know what are we expected to speak about or think about. So as ma'am told, bibliotherapy. Yes, therapy by books. So when we talk about therapy, drugs come to our like our mind first. Then it might be some sort of surgery or some sort of radiotherapy and all those things. When we think about bibliotherapy, basically, it will be use of books to heal our psychological and emotional self. And as in any type of therapy, you have an armamentarium of drugs, of surgeries and all those things, but specific things are implicated for specific type of diseases. Similarly, when we talk about books, books will also be helping some specific things. Can they be curative? No, not at all. They will only help before something starts, or when we are in certain sort of dilemma, maybe that can be taken care of. But in any type of science, we have certain questions which will apply to any of our hypothesis or idea whenever we think about. What, who, how, when, where. If we can answer these questions, for anything, our job is done. So, what? What we know, bibliotherapy. But when I talk about bibliotherapy, I'll say not only books, it is literature in whatever form. Who? So, we are a country where majority of people are poor. They are illiterate. So the first thing comes as the barrier of reading, barrier of literacy. And second thing comes as barrier of language. We have so many languages, 22 Indian languages. So where do we have a rich literature or which has been documented or being translated since ages? So now we have answered what is that. But for who we have to answer, if a person, whomever we are targeting, has enough leisure time to read or get into that literature, does he or she have proper education so that bibliotherapy does not feel like a pressure? And the third thing is, do they have enough money to get into those literary sources and get that? So if we have all those things, yes, we might sometimes heal. The next provocative question is whether reading something or be it a community activity. So sometimes at 2 to 3 a.m. you are in some hurtful situation, you are very emotional, you are at a verge of breakdown. Maybe when you read something, you can give words to your feeling which was not coming, because someone else also has that feeling. So you can give words. When you discuss it with your peers, that feeling gets deeper. And when it comes to community, maybe you start to heal. Sometimes you know about your emotions from those literature. As in, I was reading recently a book, The Difficulty of Being Good by Gurucharan Das, and I felt that whatever happened in that Mahabharata, all those destruction, everything was because Duryodhana had a bit of envy. He could not recognize his envy. If he could have recognized, maybe this thing would not have taken this far. So we need to understand that our feelings sometimes get so deep that we come at a verge of mental breakdown. And of course, in that preemptive state, a preventive state, books can be your healers if they are guided by good counselors. So we cannot take anything on the shelf and feel that that is going to help us. Anything from shelf will not help, but yes, bibliotherapy will come into emotional and psychological healing when we do it in a guided way. So how many counselors do we have, and all those things have to be taken into account when we talk about healing. In India, it has been like generational poems, generational dohas, and all those things which have been coming, like they can heal better. They are written for people. They are written for people who are marginalized or who are not that privileged. So they have been written for them, but they don't have access to reading them. So in our literature, you say what you have been, we have been enacting Ram Leela, we have been enacting Mahabharata, we have been hearing about Kabir Ka Doha, all those things. And those are the things which have been healing us since time immemorial. Thank you.
Thank you, Dr. Archana. There had been several points which have been told by Dr. Archana. I would just touch upon a few for the next panelists to expand on. Supportive psychotherapy is one area where books have been found to help a lot. And I would request Madam to take the dais next and then answer a few of these. Madam, Dr. Archana was suggesting about mental breakdown and the contribution made by literature in such conditions. Now that is where we have supportive psychotherapy. And she was also mentioning about a community get-together. Now, bibliotherapy does not mean that one individual takes a book and reads. Bibliotherapy is one common term which encompasses stories being read to children. There is something called developmental bibliotherapy where, you know, even normal children who are growing up could have some kind of guidance from stories which are read to them by the parents. Now, there is one other very important area which Dr. Archana touched upon, that is relating to oneself, relating to a particular character. The reader relates to a particular character. Now, this is again put to use in cases where children, when they are in some kind of an anxious condition, they are given a story where there is a particular character who is almost in the similar stage. This becomes easy for psychiatrists to discuss. They are able to discuss, like, you know, if I go to the psychiatrist, I don't want to be discussed myself. But then I can discuss about Duryodhana, I can discuss about Arjuna, I can kind of relate the same emotion in the character. So could you elaborate on these aspects and give your opinion, madam?
Thank you so much, ma'am. Thanks to everyone and Sahitya Academy for inviting me here. I'm in August company, and whatever I'm hearing, I'm learning at the same time. I only want to say that I would really abbreviate the whole gamut of bibliotherapy collectively as CIB. C for catharsis. It is emotional release through engagement with literature and reflective readings. I for insight. The reader recognizes aspects of their own experiences in characters or narratives, gaining new perspectives on life situations. And of course, B for behavioral modification, adopting healthier coping strategies. Now, as we were discussing, how does bibliotherapy really help? Should we follow some norms also, as we are all doctors also over here, and we are also associated with books, with writing? I feel this has to be a selection of appropriate and relevant material, which is very important. Next is there should be an engagement with the text in a reflective and unhurried manner. It should not be in a way to be hurrying through the text at all. Next is a healthcare provider or a counselor, or might be a trusted librarian, can help and guide a person as to what sort of books would do that person good in specific situations, particular conditions, also in collective book studies. And regular engagement, that is brief, brief durations of even 15 to 20 minutes on daily basis, short stories, illustrated books, audio books. This also does help. It does not need to be constant hours of reading on a daily way. It is actually the consistency which is more important than time span, and the interest actually builds gradually. Being a gynecologist, I would like to point out a few things that I've gone through. Infertility, sexual dysfunction, orgasmic disorder, these things have got lot of relation with bibliotherapy. It has been shown in researches as well. and self-help manuals do give good outcomes. Again, in my obstetric care, I've seen patients, especially those with psychological challenges, in high-risk pregnancy and recurrent pregnancy losses, multiple abortions, they do really well with support from reading. It may not be only reading about the pregnancy issues, it may be anything really. And there is something which we obstetricians, gynecologists are very scared about is PMAD, postpartum mood and anxiety disorders. This can even cause suicidal tendencies in the new mother because of post-delivery depression, inability to cope up with additional role and responsibility, especially after instrumental operative delivery, cesarean, when the patient herself is quite compromised. It's a difficult situation when there's a radical change. Bibliotherapy has shown definitive role in that. In fact, international postpartum support studies say that reading about characters or mothers experiencing such postpartum situations made these people realize they are not alone. And with recreational therapy and requisite medical care, this is even better. One more point that I want to mention about the same mothers. Mothers with children who have genetic problems and trouble in disabilities, they are very, very much helped by bibliotherapy. It has been documented in several random controlled studies as well. So from my side, I feel bibliotherapy is to be applied in plenty of other situations as well. Schizophrenia, we have a psychologist also over here, and sexual dysfunction, females are more helped by this. Cancer, people with difficulty coping up with the cancer, children with cancer, children and adolescents with cancer. Bibliotherapy has worked wonders in outside as well as in our country. And very interesting fact, 2020 September, there was a mental health problem seen amongst caregivers. So professional support for caregivers is hardly ever seen. Non-pharmacological self-help interventions like bibliotherapy gave informal caregivers a lot of boost and improvement in well-being. So might be as we go on, we'll have more things to discuss about, and I hope this is going to become even more interesting. Thank you.
Thank you. Thank you, Dr. Indradas. And before I call upon Dr. Abhay, who's an orthopedician, to give his opinion, I just have to floor one single question. Dr. Abhay, do you think that new literature will have to be written so that it would be a kind of a treatment, or existing literature can be touched upon? Could you take on to the podium and give your ideas?
Thank you so much, ma'am, for such kind words, use of words for an orthopedician. To everyone, orthopedician is someone who hails in the farthest corner away from the library in an hospital. So our relationship with books is like disaster. The thing is, ma'am, that you asked me and I want to touch upon in my speech is that new and more systemic kind of literature has to be written. Because for everyone, we have to make a tailor-made bibliotherapy regime. And for that, we need new literature. Ma'am, we say that Gali to Matrabhasha mein nikalti hai. And same is the thing with bibliotherapy. If we want to treat a patient who hails from mountains or who is a nomad by occupation, we can't expect him to understand the Victorian English and he relate with them. To them, we have to give them the plains, the vast mountains and the rivers that they can understand and that they can correlate with them. We have one theory of mirror neurons, and mirror neurons can only work when the person who is incited with knows what the landscape is, knows what is going on the novel. So yes, ma'am, we need new literature and we need focused one. And to all that, medicine is half science and half art, and the science takes a lifetime and the art takes an eternity. The nomadic person that I was talking about came to OPD 2 months back. she was suffering from a panhydatidosis of the humerus. To us, we saw the X-ray, we did the CT scan, and what we did was we took her to the operating room, did a tensioning, supported her humerus, and to us it was cheers that we did it. But then I came to the ward in the evening and I saw her. It was not the same woman that we met in the OPD. She was happy. She was lying there, tied with the bandages. She was like on the verge of crying. And what she was going through is that I lost my freedom. So we cured the bone, but we failed to cure the spirit. So what meant the spirit? We need to deal with that in bibliotherapy. Same thing happened to me 2 months back. My mother went through a complete heart block. She was on hospital bed, and now I played the role of an attendant. To the world, to a doctor, it feels like nothing, रोज का है. But to an attendant whose family member is lying on the bed, it is his world. And for 2 days, she cannot move her leg because she was on a temporary pacemaker. And when after 3 days that she was on a pacemaker, she was feeling well, the first thing that she said was, "Beta, mujhe Hanuman Chalisa suna." Isn't this bibliotherapy? Isn't this the curative power of literature that she is sitting over there? This is bibliotherapy that we need to work upon. And as an orthopedician, I may not be very well versed with all the brain theories and that goes on the gatekeeping, but there's one thing that I know, pain management. It does wonders in people who read or who takes the shelter of books or literature. It does wonders. And pain is something which every surgeon is fearful of, because there's nothing much we can do about the pain. After the ladder that we cross, the analgesic ladder, there's nothing much left with us to do. So maybe we can explore an option of bibliotherapy in that field as well. Sir William Osler said, a physician treats a disease and a great physician treats the person who has the disease. And maybe now the modern science is much more of treating the disease only and not treating the person who has the disease. I read about bibliotherapy, and the first thing I noticed was in First World War, when the people were suffering from post-traumatic stress disorder, librarians were working in the hospitals, and they were giving them the books that the person should be reading about. All the soldiers that came back from the war had a customized itinerary of the books that they should be reading. But nowadays, we don't see that in any corporate setups. So maybe this is the time that as hospital funds the pharmacies, we should also fund the libraries. So with this, I want to take your leave, and I'd like to discuss it further in the panel, ma'am. Thank you.
Thank you, Dr. Abhay. Thank you for reminding us of what had happened post-World War I, and we shall come back to it and discuss further. I would now request Dr. Neena. Madam, we, the four of us here are from allopathy, and we've been talking about bibliotherapy from our area of expertise and whatever experiences we have. You're from the esteemed region of Ayurveda. Ayurveda has a lot of traditional literature, and Ayurveda is related to the Vedic lore of the Indian system. So what is your opinion on this matter of literature being therapy?
सबसे पहले मैं हिंदी में बोलूँगी सबसे पहले मैं साहित्य अकादमी के जो सदस्य हैं उनका धन्यवाद अदा करना चाहूँगी, जिन्होंने मुझे ये साहित्य के तीर्थ स्थल पर आमंत्रित किया, उनके लिए धन्यवाद। यहाँ आकर मुझे ये महसूस हुआ कि लेखनी की कोई सीमा नहीं है, कोई बंदिश नहीं है इसका, जिसके अंदर संवेदनशीलता है, जो पीड़ा को महसूस कर सकता है, जो किसी की खुशी में आनंदित हो सकता है, जो प्रकृति की खूबसूरती को महसूस कर सकता है, उसके प्रकोप से डर सकता है, वो अपने भाव कहीं पर भी व्यक्त कर सकता है। तो जब अब बात हो रही है शब्द की, लेकिन हम जो शब्द के बारे में चर्चा नहीं करेंगे, ये आता कहाँ से, ये पैदा कहाँ से होता है, जिसके बारे में इतना बड़ा सम्मेलन हो रहा है। तो ये हमारा जो हृदय है वो राजा होता है और मन जो होता है सेनापति। तो ये जो मन है हृदय से भाव को लेकर के मस्तिष्क तक जाता है, मस्तिष्क में से वो जो हमारे नसों के द्वारा जो तरंगे उठती हैं वो हमारी लेखनी में आती हैं और सफ़ेद कागज़ पर वो भाव शब्दों के रूप में अंकित हो जाते हैं। लेकिन ये यहीं तक सीमित नहीं रहता है। जब कोई विद्वान पाठक इसको पढ़ता है तो वो उसके भाव को महसूस करता है, उसके भाव को महसूस करके वो देखता है, यदि उसने लेखक ने उसमें नदियों का वर्णन किया है तो उसमें वो डुबकी भी लगाता है, इसने पहाड़ों का वर्णन किया है तो उसकी दृढ़ता को भी महसूस करता है। तो शब्द इतना बड़ा जादूगर है, तो इसके बारे में जानना बहुत ज़रूरी है। क्योंकि मैं डॉक्टर हूँ, मेरे पास तरह तरह के मरीज आते हैं, तो मरीज जो होते हैं शारीरिक पीड़ा भी होती है, मानसिक क्लेश भी होता है उनके अंदर। तो सबसे पहले तो हमें उनको समझना पड़ता है, उनको पढ़ना पड़ता है और शब्दों का ताना बाना बुन करके उनकी मनोदशा को पढ़ करके उनके मन तक पहुंचना पड़ता है। और ये उनको एहसास दिलाना होता है कि यदि समस्या है तो समाधान भी है, और उनको ये हौसला दिलाना होता है कि आप लड़ सकते हो। दवा से पहले हमें उनके अंदर ये विश्वास दिलाना बहुत ज़रूरी होता है। और वो मैंने उनकी आंखों में वो चमक देखी है, जब वो उनके अंदर ये हौसला आता है कि नहीं, मैं जीत सकता हूँ, चाहे जितनी भयंकर से भयंकर बीमारी है या मानसिक क्लेश है उससे मैं जीत सकता हूँ। और जब ये उसके अंदर ये हौसला आ जाता है तो जो दवा की गुणवत्ता है वो 2 गुनी हो जाती है। अब हम संस्कार की बात करते हैं। संस्कार हमारे घर में जो बच्चे होते हैं, हमारी जो वाणी है ये मधुर है, कटु है, इसके ऊपर बहुत डिपेंड करता है। बच्चे हमारे कल के भविष्य हैं, यदि हम उनको उसी तरह से सिंचित करेंगे तो संस्कार जो है स्वस्थ होगा, अच्छा होगा। और मैं बड़ी बड़ी बातें नहीं करती हूँ, मैं प्रैक्टिकल की बातें कर रही हूँ कि हमारे घर में मेड है, जैसे मेड आती है तो बहुत अच्छा काम करती है और ऑनेस्टी भी है उसके अंदर, लेकिन उसकी ना बोलने का जो तरीका है, स्वभाव बड़ा गंदा है। ये हुआ कि इसको निकाल दिया जाए। तो फिर हमने कहा कि नहीं, हो सकता है उसकी बचपन में कैसी परिस्थिति हो, क्या हो, हम एक कोशिश तो उसको सुधारने की कर सकते हैं ना। तो और वो कोशिश में हम कामयाब भी हुए। अब हमारे जो सैनिक भाई हैं, सीमा पर हैं, वहाँ पर वो अपने हिम्मत से ज़्यादा वो अपना योगदान देते हैं, लेकिन उनका भी मार्मिक हृदय होता है। कभी कभी वो भी हताश हो जाते हैं जब उनके पास कोई भी चिट्ठी, पत्र या अन्य कोई संदेश वाहक पहुँचता है। तो वो चिट्ठी नहीं होती, वो शब्द नहीं होते, वो उनके लिए जब वो उसको पढ़ते हैं तो वो शब्दों के द्वारा वो अपने माता पिता के चरण भी स्पर्श करते हैं, वो अपनी पत्नी के आलिंगन करके उसका गर्माहट भी महसूस करते हैं, अपने बच्चे को गोदी में भी खिलाते हैं, और वो अपनी माँ के हाथ की रोटी का जो स्वाद उनके मुंह में आता है उसका वो अनुभव भी करते हैं और उनका पेट भी भरता है। उससे जो तृप्ति और ऊर्जा मिलती है उसको वो इतनी दुगने उत्साह से वहाँ पर फिर अपना योगदान देते हैं। तो जब उनके अंदर ये उत्साह आता है तो एक लाइन हम बोलना चाहेंगे कि वो दुश्मनों को बोलते हैं कि जरा सा मुस्करा क्या दिया, जरा सा मुस्करा क्या दिया, कमज़ोर मत समझ लेना, जरा सा मुस्करा क्या दिया, कमज़ोर मत समझ लेना, जरा सा माफ़ क्या कर दिया, कमज़ोर मत समझ लेना, जरा देखना अपने आजू बाजू धुआं उठ रहा होगा ज़रूर, आग मैंने नहीं लगाई है, बस जगा दिया है अपना गुरूर। तो ये है। और हम बात करते हैं कि हमारी दैनिक दिनचर्या में बहुत सारे प्रश्न होते हैं। यदि हम अपने जो प्रश्न होते हैं रामचरितमानस, गीता में उठाते हैं, उसको खोलते हैं तो उसमें हमें प्रश्नों के उत्तर मिलते हैं। और आयुर्वेद की बात करते हैं, कितनी हजारों वर्ष पहले की बातें हैं ये। उस समय चरक, सुषुप्त, अष्टांग हृदय जैसी बुक, बाघभट्ट, इस तरह जो हैं भारद्वाज ऋषि मुनियों ने, उन्होंने जो एक एक जड़ी बूटियों के बारे में बताया, यदि उन्होंने अपना पुस्तक नहीं लिखी होती तो आज उन जो ज्ञान था वो उनके साथ चला जाता है। उस पुस्तक को आज भी हम पढ़ते हैं और मरीजों के ऊपर उसका प्रयोग करते हैं। तो पुस्तक हमारी सखी है, हमारा सखा है, हमारा दोस्त है, हमारा गुरु है, हमारा मार्गदर्शक है, हमारा मार्ग प्रदर्शक है। तो इसके लिए भी मैंने पुस्तक के लिए भी 2 लाइन लिखी है, सुनाना चाहूँगी यदि आपकी आज्ञा हो तो। किताब को बना लो दोस्त, किताब को बना लो दोस्त, जगाए रखेगा हमेशा होश, कभी नहीं होने देगा मदहोश। जब कभी डगमगाए जीवन का रथ, हर मार्ग को करेगा प्रशस्त। ये है अर्जुन का सारथी, सारे रहेंगे तुम्हारे प्रार्थी। साहित्य है आत्मा का चिकित्सक, यही है हमारे जीवन का निर्देशक। साहित्य को बनाते ही हथियार, करता है सारे सामाजिक शारीरिक मानसिक शत्रुओं का संहार। ये केवल लेखनी नहीं है, व्याधि को दूर करने के लिए है वैद्य का उपचार। हर क्षेत्र में देगा तुम्हारा साथ, बस साहित्य से कर लो प्यार, बस साहित्य से कर लो प्यार।
Thank you, madam. I think all books would stand up to thank you specifically for your supporting them so much and giving us an insight as to how questions in our minds could be answered by some of the books, especially traditional literature. With so much having been said, I would like to ask a few questions to these panelists who could answer them from their expertise. Madam Dr. Archana, you were talking about how one can relate oneself to books. And you also made a very categorical statement, anything from the shelf will not be in a position to help. The question here is, who standardizes or who would be in a position to guide as to what should be read? Could you elaborate on that? You could probably be seated. Can we have one more mic? There is one mic there.
Thank you so much, ma'am, for this wonderful question. So, in this context, I would like to say that we have professional therapists, counselors, and as Sir rightly pointed out, at the time of First World War, there was librarians. So they are efficient to do all those things, given that they themselves have an interest in reading. Because as they read, they'll identify what is for what. What type of books are for what type of ailments. As I told earlier also, they cannot be standalone therapy. Books or literature, they cannot be standalone therapy. Of course, they will be good companions, companion of the people reading them and companion of the treatment which we are giving to them. So they'll be companion to both. Because what happens is, it has been shown in the studies and it is present in literature that when you read something, when you are reading a particular emotion, what happens is neurons and neurotransmitters of those types are activated in your system, in your brain. And that same type of emotion is being seen if you try to capture that through functional MRIs. The second thing is that when you are reading something and you feel that your emotion has been felt by someone else, or your emotion is valid, it is not, you are not alone. What happens is your cortisol levels decrease by almost 68%. So these days we would be reading everywhere, or we would see the ads and everything, which talks about cortisol detox. That is the reason why we are getting obese. That is the reason why many things are happening to us and we are going to many problems. But that happens because we have high cortisol. We are always in anxiety. We're in anxiety of performance. We are in envy of people doing better than us. We are seeing, like, we are having FOMOs, right? The fear of missing out. So all those things are taken care of if you make books good companion. But yes, who will standardize? Therapists will standardize. And some things might be available from traditional literature, and as it has been pointed out that some things we need to start building up from now on if we agree with that.
Thank you, Dr. Archana. And this is now to Dr. Abai. Dr. Abai, you mentioned specifically about the post-World War scenario. Though I agree with you that bibliotherapy had a boost during the post-World War time, and that is when the very term bibliotherapy was coined. It was in 1916 that this particular term entered the dictionary. But then what I would want to differ here is that in a war scenario, the librarians specifically recommended for certain books to patients who were in the military hospitals, which mean they were either injured in the war or they were war veterans who had undergone some kind of a problem and had come to the hospital. Either they were physically traumatized or they could have been mentally traumatized because of the war necessities. Now, that would not be the same case in any other hospital now. There are different things. Scenario is completely different. Though the world would always have some kind of a war scenario in some part of the globe, nevertheless, most of the hospitals whom we are talking about, even the nomad woman that you were referring to, these are different kinds of situations where people are afflicted by some other spectrum of diseases. So would you recommend the same kind of a therapy here, or would it be something different given the same genre of books?
Thank you, ma'am. As you have rightly pointed out that the scenarios differ. In the post-trauma or the post-war era, the sufferings were like different, and the person who is suffering from a road traffic accident, the suffering is completely different, and I completely agree with that. Okay, thank you. The thing is, ma'am, this is that is why I pointed out that we need custom-made literature. And the other thing is, as an orthopedician, as a surgeon, as a gynecologist, I think that it would be better if we refer this to a psychiatric friend of ours. We need specialized care, and we need to start referring those patients to them. So we need to make it a habit that any patient who is admitted in the ward, we should get him or her checked by a clinical psychologist or a psychiatrist, so that they can better guide us whether the person who is at that place needs the bibliotherapy, or he needs some other kind of therapy, or he does not need therapy at all. So that is where we need to start recognizing as a practitioner of modern medicine that there is something like bibliotherapy that could help our patient, but then at the same time we are not the person who are like in the position to tell whether this will help or not. And ma'am, there's one question that I like to ask Archana ma'am. We are talking about bibliotherapy, that books will help, books will not help, but most of the patients that I see in trauma wards are youngsters. And they are like loaded with dopamine detox of like reels and YouTube. How to make them comfortable with books, and how to tell them that, guy, just start reading the book and this will help you? Because I don't think any kind of motivation will help them start reading the books, and this is something that literature world is suffering from, that we lack readers. We have plenty of writers, but we don't have readers. So ma'am, what can we do?
I would add to whatever Dr. Abhay has said, a question part of it. I would add another question to it. Dr. Archana, you could answer. As rightly said by Dr. Abhay, there are no readers now. The reading habit is on decline. Though there are writers, reading habit is generally on the decline. So how do you get the younger generation to read, especially school-going children to read? As a clinical pharmacologist, do you have any recommendations for that?
Thank you for this very pertinent question. I agree to this that readers are less. And if I talk about adolescents and children nowadays, there's only one thing they'll do. They'll mimic. Because as I already told, fear of missing out. So I'll tell you, why am I reading or writing? So since I was a kid, my dad, he's sitting here, he's a professor of chemistry. And in our house, out of the 4 rooms we had, 1 room and a veranda, so basically 1.5, they are filled with bookshelves, and they have only books. And when I mean books, that's not the tidy books kept in the shelf. There are books on the shelf, there are books on the windows, there are books on the floor. And I have seen my mom angrily, quarreling with my dad if some guest is to come. she will tell at least take the books out of the bedroom and keep it in your study. So there'll be books on the bedroom floor and bed everywhere. So now we are three of us, two brothers of mine and me. Now what do? We don't have anything else in our house. What do we have is books. And I see my mom and dad both reading and writing. So much so that my dad got a Bal Sahitya Akademi Puraskar in 2016. So he has been doing this from his childhood, and he has made it our way since our childhood. So there's no other way. You cannot give them any incentive to the kids. You cannot do anything. You can just give them the habit what you have in our house. As ma'am was telling about sanskar, giving sanskar to kids, giving sanskar to her maid. So giving sanskar to kids is, if nowadays what happens, all of us are too much engrossed in our mobile phones. And that's why a kid 1 year old or 11 months old does not eat till you show him the screen, him or her the screen. So if you inculcate a habit of reading, that person will also inculcate a habit of reading. Right? And so you will be thrilled with books. Your exhilaration comes with books, and that's why your dopamine and serotonin will release when you see books, when you read books, when your emotions get identified with books. Thank you.
Thank you, Dr. Archana. And now to Madam Dr. Indra. Madam Dr. Archana made a very pertinent point saying that children mimic your gynecologist who deals with mothers and mothers with children too. Now, one important transition that's happening in these days, the so-called Gen Z, does not even want to mimic. Their idea of success or idea of positivity is, I would want to be aligned to what I want to be. So this is that kind of a transition where children no longer want to mimic what their elders did. So in such conditions, would keeping books at home help the children pick them up and read? Now, one other question to you. There's so much of discussion about literacy and making new books and all that. Now, there is a genre called graphic stories, which are also called healing stories, for a kind of a setup like India where not many people can read. Stories are made in graphic forms, maybe running to hundreds of pages, and people who cannot read much are given these kinds of books, where these books have been found to reduce symptoms in anxiety disorders, symptoms in alcohol addiction, and so on. So what is your take on that?
Thank you, ma'am. Thank you so much. They are both very interesting questions. Now, I wholly and truly agree with you that mimicking parents is really not the things which happen nowadays in every household. No matter how many books you keep in front of the child and how many almirahs are full of books. Over here in this situation, the Gen Z goes through a lot of trouble as well. There is much more competition in life, much more struggle in life, and the growing up process itself has become very, very complex. It is not as it was before. So what I feel is keeping books for young people or adolescents or young corporates, the books should be there to help them. They should be helpful to them. Like there may be people, there may be children who would like to read books which help in understanding what are the things which can cause trouble and what may be consequences. Those books can be even illustrated ones or even audio books. If children are not at all fond of going through scripted literature. Again, adolescents people, reading of novels or fictions may give some insight into character forming and understanding how to deal with interpersonal problems as well. And there must be more books by recent authors as well who can really address current problems in the life. May it be workplace, it may be personal problems, it may be sentimental issues, or even problems growing up in the family with the parents. So when we can supply these books at random, of course with a therapist, of course with a learned accommodation or a librarian who can guide, I feel reading books are definitely going to increase in number. The children, the young people, the adolescents, even the little ones, they have to be shown that books are friends. They are not worthless things to handle. The books has to help them. The books have to answer the questions that they have in their minds. The books has to show some amount of light. So books are definitely going to be welcome, and I feel book reading is going to come back very soon. I'm seeing young people going back to books once again. Yes, mobile phones and yes, reels and TikToks, they are a lot of distraction, but definitely things are going to look brighter. I have that conviction. The next one that you were mentioning about, I feel it is an excellent thing to go into graphics, and especially illustrated books for the people who cannot go into very difficult texts. It is very necessary. And also, there are people who are not going to be able to see books, read books because of a cataract operation, because of an eye problem, because of lack of time. Why not audiobooks? Of course, these are not to be given to people who cannot afford so much, but then audiobooks are really in demand abroad, and audiobooks may be an answer to the question.
Thank you, Madam. And Madam Dr. Neela, like there had been a mention of two diverse situations by both Dr. Indra and Dr. Abai. Dr. Indra mentioned about reading sessions helping people with infertility, people with some kind of sexual dysfunctions. And Dr. Abai was very specific when he said reading Hanuman Chalisa to his own kith was very helpful. Now, with this kind of a background, can we think of planned reading sessions in educational institutions? And is there anything in the tradition that would go in favor of it? A planned reading session on specific areas in educational institutions.
थैंक यू मैम. ये मैं बात करना चाहूँगी कि आजकल के बच्चों का दिमाग जो ब्रेन है बहुत ज़्यादा डेवलप होता है. शारीरिक क्षमता के बनिस्बत यदि आजकल के बच्चों को हम ज्ञान देने बैठेंगे ना तो कभी नहीं सुनेंगे. मैंने इनको यदि हम कहानी के रूप में जो भी कुछ बताना चाहते हैं उसको कहानी के रूप में, कथा के रूप में समझाएंगे ना, उसको बहुत ध्यान से सुनेंगे. मैंने इस पर बुक भी लिख रखी है. मैंने बच्चों को, पहले मेरे दिल्ली में मासिक पत्रिका भी निकलती थी और मैंने इसमें लिखा हुआ है बाल आहार और स्वास्थ्य के बारे में. तो यदि आप किसी बच्चों को बताना चाहेंगे, ओह मुझे पता है, तो इसको मैंने कहानी के रूप में जो कुछ भी बताना है तो उसको बच्चे बड़े ध्यान से सुनते हैं और उसका अनुसरण भी करते हैं और उसको याद भी रखते हैं. और जो आजकल अवसाद, डिप्रेशन, एंजाइटी, ये सारी जो प्रॉब्लम हो रही है, क्योंकि हमारा देखिए जो हमारी हेल्थ है, फिज़िकल हेल्थ है, उस पर तो लोग फोकस कर ही लेते हैं, लेकिन जो मानसिक जो हमारी है, जो डिप्रेशन, एंजाइटी होती है, उस पर ध्यान देना बहुत ज़रूरी है. वो कैसे करना है? क्योंकि आप सबको पता ही है कि हमारे ब्रेन में जो सेरोटोनिन, ऑक्सीटोसिन, डोपामाइन, एंडोर्फिन जैसे हार्मोन्स होते हैं, वो यदि हम बड़े बड़े हॉस्पिटल से पहले अपने घर से शुरू करें ना, वो ज़्यादा बेहतर है. हम पहले अपने, क्योंकि हम जो बीच की कड़ी होते हैं, बच्चे और फिर हमारे जो बुज़ुर्ग होते हैं, बच्चों को भी हमें देखना है और बुजुर्ग भी हमारा इंतज़ार करते हैं. यदि हम उनको एक हक भी कर लेते हैं ना और उनसे थोड़ा सी बात भी कर लेते हैं ना, तो उनका भी जो सारे हार्मोन्स डेवलप हो जाते हैं और हमारी भी एंजाइटी दूर हो जाती है. यदि हम इन छोटे छोटे बातों को ध्यान में रखेंगे, अपने डेली रूटीन में ध्यान रखेंगे, और जैसे आप जा रहे हो, ये अपनी रूटीन में बना लो, आपके पास कुछ नहीं है, आप बड़ा कोई मिलता है उसको आप विश कर लो, छोटा बच्चा मिलता है उसको प्यार से कर लो, तो वो एक सारा हार्मोन सिस्टम रहेगी। बुक की बात, और उसको वो तो मस्ट है, उसको पढ़ना ही चाहिए, और बच्चों को बचपन से ही हैबिट डलानी चाहिए, चाहे आप उसको कथा के रूप में, कहानी के रूप में, जैसे भी हो सकता है, क्योंकि बुक हैबिट, बुक जो ऐसी एक पावर है जो हर तरह से हील कर सकती है, चाहे वो आपका कहीं पर भी हो, आपको हर कोने पे पहुंचा सकती है, जहाँ पर आप पहुंच भी नहीं सकते, हर चीज़ का ज्ञान दे सकती है। तो जो बुक है वो हमारी सबसे बड़ी दोस्त है, हीलर है, सब कुछ है।
Thank you, ma'am. Dr. Abai, there is something that Dr. Neena touched upon. She included storytelling sessions, stories which can cater to the children and kind of open up. But then here I have a point of difference. Now, sometimes some kind of stories could even get them into a negative framework of mind. We've seen this with creative arts, we've seen this with movies, where some movies, instead of giving the viewer a positive framework of mind, could even give them a negative framework of mind, or taking the law in their hands and similar situations. So what is your opinion on this?
A man's mind is a cruel thing, like I say. We, like one of our HOD used to say that if you keep two bottles, in one you put water and one you put alcohol, and you drop a worm in one of them. A normal person will say alcohol is bad, it killed the worm. But an orthopedician will say water is bad, if you like drink alcohol, you will not have worms. So everything, like every coin has two sides. So you really cannot monitor this thing that a person, like in 100 or in 1,000 or in a million person you meet, one will become a serial killer, and you really don't know who that one will be. So we cannot like closely monitor on each and every child, like what things they are like gaining from the sessions or not. But yes, I do feel that planned group like reading sessions will not be that much of a success, because when you take a group, the cluster comes in, and when the herd mentality sets in, you really can't do anything. Individually, they all are very nice child, they are very good people, but when they come in a herd, they cause stampedes. So this is something that you need to inculcate in the families only, that you need to tell each of their parents that you should abstain from phones, you should start reading, then they will copy you. So planned sessions for reading will not be much of a boom, but then as you rightly pointed out that Gen Zs are someone who I will do it my own way, but I'll frame it like this, that they are rebellious. If you tell them you should not read, they will read. So this is something that you need to inculcate in yourself, that you need to know that you have to give them a negative reinforcement. They will start doing it, and then just let them do it, and don't give them positive reinforcement whatsoever. So this is my way that I think this could be done. Thank you.
Now, this is a question that I would want to pose to all four of you. We've all the while have been talking about reading sessions, reading books, audio books, and so on. But to my understanding, bibliotherapy also includes writing sessions. So what is your take? One by one, if you could give. Yeah. Yes, ma'am. Yes.
My mother had been inspiration for me, everyone's mother, but my mom had been a principal of a school, had shown the light of knowledge to hundreds and thousands of students in her life in a very reputed school in Kolkata, and she retired as a principal. After my father's demise, I brought her to myself, and she lived with me for the last 6 years. 6 years were a period of wonderful timing that I had with my mom. We doctors hardly have time with our family. But those 6 years when I could look after her, they were heavenly. But for the last 2 years of her life, she was gradually losing her memory, going into Alzheimer's. And that was the time when she started writing a diary. She always had this habit, and I encouraged her. And you would not believe that diary has now taken the form of a book, translated into 3 languages, published by Rupa Publications last year. So she was actually, when she was losing her memory, her Alzheimer's were giving rise to a stronger memory of her childhood, of staying in East Bengal, of the partition of India, of the famines of India, of the independence, almost 100-year-old socio-political cultural change. And she felt so much better. Her situation of her blood sugar and her mental happiness, her blood pressure, they were much better. Now again, after she passed away, I was entering a phase of depression. I'm going to be very clear over here. So that was the time when her diary came in my hand, and that saved me from that very dark period. I could gradually wean over from my antidepressants because I was writing my mother's book from the diary, and the book had saved me. I am so thankful to you for putting up this point. Bibliography should include the writer as well. It is a savior for not only the reader who's reading, it is the savior for the writer as well, because it's a part of the soul that we cannot bear to others.
So I totally agree with ma'am that writing helps. I myself started writing when I was in standard 3rd, so of course those poems would be childish. But whatever you show me rain, you show me clouds, I would write. Later, when I entered in my master's course and all those things, you understand there is departmental politics, then comes the envy with the colleagues, then come some things, and you cannot express it to anyone. If you tell to your family, they'll also feel bad, and you don't have so many of friends at that point of time to share those things because school friends are left behind and all those things. So at that point of time, when you feel that maybe you don't belong, sometimes you feel that people are being too envious, sometimes you feel you are too good and there's no one to show reciprocal altruism to you. So all those point of time, of course, writing a bit of your emotions, and that comes in many phases at many points in life, I think. So those things, writing, if you can express your feelings at that point of time, that loosens your burden, that loosens your tension knots a lot. So I'll totally agree with that.
Ma'am, you rightly pointed out that bibliography, the major part is writing. And we all, in a way, have experienced the curative effect of it. And yes, I completely agree with ma'am that when I was in rage, when I was like envious, or when I was like angry, or I was about to cry, the minute I started writing, my mind diverted. And after writing a page or so, I realized itni important cheez nahi thi. Maybe this is the power of bibliography. To me, it was therapy, ma'am.
राइटिंग की बात हो रही है तो राइटिंग और पेंटिंग दोनों भाई बहन हैं। बच्चा जब बचपन से आपने नोटिस किया होगा जो लिखता है वो धीरे धीरे पेंटिंग करना शुरू करता है, क्योंकि उसकी दिमाग में वो लिख तो नहीं सकता है ना, तो वो पेंटिंग करना शुरू करता है छोटी छोटी चीज़ों, क्योंकि उसके दिमाग में वो डेवलप होना शुरू हो जाते हैं। क्योंकि हमारे घर में डॉक्टर साहब हैं, मेरे हस्बैंड APGI में और प्रोफेसर हैं, ऑर्थोपेडिशियन है, और हम लोग के घर में माहौल ही है लिखने पढ़ने पेंटिंग का। मेरा बड़ा बेटा भी GST में सुपरिटेंडेंट है, वो भी बहुत अच्छा इंग्लिश में लिखता है, उसका भी 4th को उसका भी है सेशन। तो ये वही जो मैंने बात करी थी ना कि घर में बचपन से जैसा आप माहौल बनाओगे ना पढ़ने का लिखने का, फ़ोन का जो ये आजकल ज़माना आ गया ना वो गलत है, वो सारा कुछ गलत करता है। यदि हम घर में एक एक चीज़ को, आप दीवारें भी बोलती हैं, हर चीज़ बोलता है। यदि आप इस तरह के भाव आप डेवलप करोगे ना, लिखना अपने आप से, बचपन से पढ़ना और लिखना अपने आप शुरू हो जाता है। तो ये जो मैंने कहा ना कि जब बच्चा उस समय तो पढ़ना लिखना नहीं जाता, ABCD जानता नहीं है, तो वो पेंटिंग से अपने भाव व्यक्त करना शुरू करता है। तो राइटिंग और पेंटिंग दोनों भाई बहन हैं।
Thank you. Yeah, in a way, it's a kind of a psychological catharsis, and I've seen it myself. I am part of the management of a school, and very often I find some of the slow learners who are being bullied by their peers. You give them a kind of a notebook and tell them you write whatever you want. Don't bother about anyone, no one else to read that notebook. Please bring it to me. I find, all the pages filled up. Those slow learners, so-called slow learners, were able to fill in pages with real readable material, but most of the material also helping them in a kind of a catharsis. So thank you very much for those answers, and I just have 3 points to moot out, and I would request any of you to take each of the points and then answer, and we'll throw the entire session open to the audience. Now, point number 1, Dr. Abhay, you were talking about Hanuman Chalisa and chanting it to your mother and all that. But then, is it really kind of bibliotherapy or something else in it? Bibliotherapy is wherein the particular literature caters to the individual spirit, or heals. Most often, things like Hanuman Chalisa, when they are chanted or recited or heard, it is not that you go into the word component of it. You don't even, concentrate to understand the word there. It is more of the Shraddha which is inside, more of the faith which is inside, and hearing it gives you a different kind of a psychological boost. So I would like one of you to give further opinions on that. And point number 2, there was so much of discussion about reading, and reading causing a kind of changed neurowiring. All of us know there is so much of neuronal circuitry that gets developed because of reading, because of writing, and because of hearing something, committing something to memory, repetition. All these increase the neuronal circuitry, and Madam was talking about Alzheimer's getting a little reduced, the symptoms of Alzheimer's, which again is part of this increase in neuronal circuitry and the secretion of the neurotransmitters. So your take on that, any one of you. And the third thing is, when we talk about books being part of treatment, which one would you recommend? Fictional or non-fictional? Or what is your opinion on the so-called genre of books, self-improvement books? Now, the self-improvement books are hard, hits on the stance. So what is your opinion on that? Anyone can take any of these.
This is very interesting. Like when our panelists talked about Hanuman Chalisa, it's true, it's very true, as ma'am said, that might be the person who was listening to Chalisa was not really following every word of it, but I feel it is a mixture of the care and the time that the son was giving to the mother, which was extremely therapeutic. And when a person grows up, grows old, listening to those chants, somewhere a little bit of idea always lingers inside the brain what it is about. Most probably that is how it helped. Now, talking about what sort of books help one, this really cannot be one bill fits others, everyone. No, it cannot happen that way. Like there might be a mature individual who after retirement has nothing much to do and is worried about the way he's going to continue with his life. So for him, reading books which are illuminated lives or biographies may be helpful. Otherwise, a person, a young individual who's just started a job in a corporate place, climbing ladders, for him, reading books which work around with career, especially, and interpersonal relationships, how to deal with them, that is going to be more helpful. Children, as we all know, children, books are character forming. This is a very important piece of information. It has been found that when in a group study, I beg to differ with Abhay, in a group study, when children are being read about a fiction, not fiction, fiction where something is being mentioned about bullying and teasing, there has been children who are coming out with their own stories of bullying and teasing, which can be really, really devastating. And when these sort of group studies continue for some time with dedicated therapists, counselors, and teachers, this can help the children to cope up by themselves with that sort of situation. So it cannot be one book for everyone. Every person has a book of his or her own.
To answer the second question, ma'am, I had asked about neurocircuitry. Of course, as I was talking earlier also, that when you are reading something, the emotion flows. And that shows in scans of your neurons as well. You see the areas lit up. You see the areas very distinctly having certain functional changes. And those small changes are what build up the potentiation or the connection of your neurons and might help in dementia or other emotional breakdowns as well. Second thing I'd like to take up is fictional and non-fictional. So most of us would have heard and read a 5 Point Someone by Chetan Bhagat. Very light read, very light read. But then think about those students who got into certain elite institutions like IITs, AIIMS, and all those medical or engineering colleges, management colleges, and they were feeling not to belong there. They came because their parents wanted to. They did not even have time to think about it. They were doing their school and college and entered there. And there they found, and in that book, those people find 3 heroes of theirs who do not feel they belong. And they feel that, okay, it is okay to be just an average student. It is okay not to excel at sometimes. It is just okay. Life is bigger than all those small winnings. And in that whim of a moment, many people, maybe they did not take some extreme steps, because nowadays we hear that from these elite institutions, there are too many suicide cases as well. So in that whim of a moment when they could have taken certain, say, extreme step, which they would not even be here to repent later. So if maybe we have certain light reads as well which help them. So it cannot be again specified to a single genre of books or a single book at all.
So I think with much said about books being or literature being a part of therapy, if there are questions from the audience or any opinions, we could throw it open to the floor.
Keep the question short.
I think to progress bibliotherapy and to progress the habit of reading, I think we could suggest that the government should ban using smartphones for anybody who's below 18 years.
A good suggestion, sir. Well taken here, and let's see how well would it go into the appropriate fora.
Ma'am, अब मैम अभिव्यक्ति की आतुरता या outpour of the expressions which inspires us to pen down what is circulating, what is revolving in the mind. And also Indra ma'am, I think Indra ma'am referred for the audible books as well, है ना, which can be of a real asset for a visually impaired like me. I always want to write, and I was with inborn things, and so but I do have a library in my home. और मेरे को भी ऐसे था घर पे सबसे डिस्करेजमेंट हुआ कि बुक्स इतना सारा क्यों, और पेपर्स भी, न्यूज़पेपर्स भी, तो मेरी जान निकल जाती, कोई एक भी बुक मेरे से ले, न्यूज़पेपर ले, तो मैं पढ़ भी नहीं पाता उसको, या अपनी वाइफ का हेल्प लूँ या सन का हेल्प लूँ या किसी फ्रेंड का, तो ऑडिबल बुक्स अच्छा है ऑप्शन. अभिव्यक्ति की आतुरता मैं बोलता था, है ना. थैंक्स मैम.
Thank you. That's a good thing, like, you know, audio books. Plus, maybe, as was told by a few of them here, someone in the family, if it's a child, it could be the elder. If it's the elder, it could be the younger person. Someone in the family could read. And, I mean, this apart from bibliotherapy, the core value of bibliotherapy, I personally feel when you read something, even if you are able to read something, read it. The second time, I would even suggest to some of my students, you don't read it. Give it to someone else to read it. You shut your eyes and listen to someone else reading it. I think the emotions are better captured than one reading it themselves. The emotions are better captured when you hear it from someone else. And that's a very good point made by our friend. Thank you very much for that. And
May I ask a question?
yes, ma'am.
Okay. So, you know, we've talked about reading books and we've talked about Hanuman Chalisa. I don't come from a tradition of the Hanuman Chalisa, but it gives me peace. And I find that because it is, words have energy and cadence. So it is that affects me. So the energy comes from that. It's not blind religiosity at all. Which brings me to my question that, you know, how about, you know, instead of just books, how about poetry or listening to songs and reciting aloud, because that can be very therapeutic as well. What do you think?
Ma'am, I'll take this question before, I mean, I would leave it to them if they would want to answer something more. Poetry reading. In fact, bibliotherapy more so started with poetry reading. And because for that matter, most of the languages in the world, especially Indian languages, are not epic languages. These are lyrical languages. And their origin is from lyrics, and poetry is part of the entire system. That's one. Second thing, poetry has musicality. Musicality per se has a calming effect. And there had been researchers who had been working on some of these chants, especially the Indian chants like Hanuman Chalisa, some of the other chants like the Sahasranama, where there had been some workers, even in countries like Germany, they've made people chant these and then record the EEG of the listeners, not the chanters even, the listeners. And they found there is a good increase in the alpha waves in the EEG. Alpha waves would indicate that the brain is calm. It's not anxious. There is calmness in the brain and some kind of anxiety being subdued, you know, that kind of a panic situation being subdued. And point number 3, you know, I come from the southern part of India. In the southern part, we have certain chants, the words of which have no significant meaning. In the sense, there are some chants which just keep narrating number 1, number 2, number 3, you know, something related to these are all 1, these are all 2. You know, just look at things. Okay, man, woman, 2, and 2, 2, whatever kind of you can relate to 2. all these are 2, and then all these are 3. There are 3 things, this end, that end, and the middle, something of that kind. These have no significant information except that an enumeration of numbers. But then these chants you find are considered so very important that sometimes history records that they have even reduced poison levels in an individual. Even snake bites have been cured. So we have people say that it is the word, the power of the word, than the power of the meaning sometimes. And I get often reminded by this statement, we have a word mantra. You know, across Indian languages we say mantra. The definition for mantra is Trayati iti mantra. Whichever can be called a mantra is the one that can save. If something can save you, Trayati iti mantraha, that which can save you is a mantra. So if it can save you from many things, not necessary that the word should have a particular meaning assigned to itself, or beyond the meaning, it could still be a savior. And I mean, if anyone.
So, I have been working in neuropsychopharmacology since long. So, I'd like to add just one bit of it, as we were talking about that specific words did not have meaning, or we might not come from that origin which signifies that words. But in medical science, and particularly in research, there is a term called placebo effect, which does not have an activity of its own. It is inert. But if you believe it is there, that will happen. So basically, as Sir was talking about pain management, and he was telling that those patients get healed. So because pain is a very subjective feeling, the same amount of infliction on me or on you might cause different type of pain based on our tolerance that we have developed. So now the thing is, if you go to a particular physician or a doctor and he treats you very badly, he gives you exactly the same medicine what any other guy would give. But if he treats you badly personally, you are not going to heal from his treatment. You'll still feel some residual effect, you'll feel all the adverse effects listed, or maybe adverse effects not listed. But if that person talks to you very nicely, some of your suffering is gone at that point of time when you have not even started taking medicine. Your blood pressure comes a bit down because you are becoming calm. Why? Because you believe. So that's the power of Hanuman Chalisa, Mahabharata, Gita, Ramayana, and all those scriptures which are present there. I might not have named them because I don't know them, but because we believe that they have that power, so they heal us. That is, of course, very true that they will heal because we believe.
I think there is a little more to it. If you look at teenagers with their angst, they're usually love-struck, most of them. In the north, we see people like Mirza Ghalib, Mir, who are classic poets. They still resonate with the youth because they find expression through that kind of poetry, which is high literature. But the resonance happens more if they recite it out loud, even to themselves.
Agreeable, ma'am. I would like to add something to what Dr. Archana said. On one side, it's the placebo effect. Placebo effect will depend on the belief and the faith. That's one. On the other side, now I'm part of a research program wherein we tried some of these chants, the Vedic chants being given to people who don't belong to this country, because we have some cultural common research projects on. So they don't believe in that. They don't believe that this can do something. But then it's been noticed that they also get calmed down. So it could be something beyond belief also. So maybe much has to be done and seen, and much has to be done in the way of contributing to, as Dr. Abai right at the beginning said, yes, we need to have a horde of literature coming in, new genre of literature coming in, tailor-made literature for people who require them.
I think that's been a good session.
Thank you, ma'am. I think with that, if there are no further questions and opinions, we will declare the session closed. And thank you very much. That had been a wonderful session, and I would like to thank all the participants. So elitist of them that they came up with everything under the sun for this particular topic. So thank you very much, all of you, and thank you very much to all members of the audience for making us discuss all these things. Thank you.
Thank you all. A very big thank you to the audience, especially all of you who asked the questions. I'd like to thank our panelists, Srimati Sudha Seshayan, Abhay Singh Badwal, Archana Mishra, Indira Das, and Neena Kanodia for this wonderful session. We would like you to take a photograph, so just come to the front of the dais. और आप सबसे कल सुबह 10 बजे मुलाकात होगी. सभी सभागारों में कुछ ना कुछ प्रोग्राम है. यहाँ पोइट्री सेशन होगा. Okay.